some valuable information for a diagnosis?
I usually go for chief complaint, mechanism of injury, then physical exam.
Perfect, you're exactly right. So it's going to be, when you say chief complaint, that's a symptom, right? Where does it hurt? That's the most important thing, right? If they point here, or you can't diagnose it with an ulcer or something. You see what I'm saying? So the symptom is the most important, and then the second is the mechanism of injury, right? That's critical. Why does it hurt here, right? And then the third is the exam findings. So for a ligament, what is the symptom going to be? What's the most common symptoms, right, for a ligament injury?
Pain.
Pain, yes, and it will be a certain kind of pain. What kind of pain? There's a certain kind of pain. It's called positional pain. In other words, if I put my arm here, it doesn't hurt. If I move my arm here, it does. Certain positions cause pain. That's an orthopedic test, right? That's all orthopedic tests are, is trying to challenge it. But almost everybody who has positional pain, if they have back pain, neck pain, they go, as long as I hold still right here, okay, it doesn't hurt, right? Make sense? Positional pain. So that's the first thing you're looking for. Someone goes, I have positional pain. Certain positions hurt. In some people can't find a comfortable position, but typically you can. If you neutralize, because what is ligament injury? Ligament injury is, as long as you don't move the ligament, you're not firing the pain receptors, right? So positional pain. That's how you know if someone has cancer. It hurts no matter what they do. And if you can't make the condition worse by moving it, it's probably not a ligament. But a ligament you can always make worse. Got it? So how many patients have you seen, Dr. T, that didn't have positional pain? Can you think of one patient you've seen that didn't have positional pain in our office?
I don't think so.
You can't. And how many patients have come to see you so far through our office that didn't have ligament or tendon or cartilage injuries?
150.
Yeah, they've all had it, right?
Yeah.
That's what I'm trying to convince her. I'm trying to help her understand. This is all we treat in our office, and this is what the general public has, and this is why if everybody knew what we know, we would not have enough people. We would need to hire a dozen more practitioners, because this is epidemic proportions. I don't know if you understand this, but I feel like I'm trying to save the world. I'm trying to save it. How many patients have you had that hate their life and their pain is dramatically wrecking their life? I have people who've lost marriages because of it, you know what I mean? Because they're grouchy and whiny and they're miserable people to be around. We have patients who come in and the whole front desk is like, we hate them. They're jerks. They're mean.